Hi, my name is Julianna Peña. I am a professional fighter in the UFC, and I had a C-section. I wasn't expecting it at all. As a matter of fact, my mother came to town to be with me for the birth, and she said, "You're not even close to giving birth yet. You haven't dropped a bit." And I went to the doctor, and they're like, "Oh, yeah, you're breech. You need this baby to come out tomorrow." She wasn't dropped at all. I wasn't dropped an inch, and that explained why my belly was still so high. I first heard about Mercier Therapy through a friend of mine in California who's a chiropractor, and she told me to listen to the BIRTHFIT podcast.
This is Dr. Lindsay Matthews. Today on the BIRTHFIT podcast, Dr. Jennifer Mercier. She is the creator of...
I had no idea. Now I'm sitting here with this C-section scar and not really knowing how to recover from it besides bed rest. And once I listened to the podcast, it was absolutely mind-blowing in the sense that I didn't realize, like a major surgery you would get on your shoulder or knee, you need to have therapy afterwards, physical therapy or any sort of rehab or rehabilitation in order to get back your body to the way that it once was.
Well, if you have surgery on any other area of your body, you're going for physical rehabilitation to help rehabilitate that joint, to help break up scar tissue, to help optimize joint function, or even organ function. People that have had surgery on their heart go for cardiac rehabilitation. So the uterus and the ovaries and the bladder are no exception. They also need the attention post-surgical, and C-section is a huge surgery. You know how when you cut open an apple and the apple is exposed to room air and it starts to oxidize or turn brown just after a few short minutes? That's the same thing that happens with your organs. You're opened up, the organs are exposed to room air, tissue oxidation starts to occur, scar tissue starts to form almost immediately. So when those organs are put back inside the body, then the healing starts to occur. Healing is scar tissue. That's our body's protective mechanism. But that scar tissue, while necessary, needs to be broken down and softened so that it doesn't glue everything else down in the pelvis. We've got to optimize the ultimate function of the pelvic organs so that we can have blood flow that will just create more of a wellness, more of a balance. But just as if you'd cross your legs and your foot would fall asleep, and then you release that cross and you allow your foot to wake up and all of those pins and needles sensations are coming back, that's what needs to happen to tissue that's being restored in its optimal function. You couldn't weight bear on your foot without having blood flow. Blood flow is life. Blood flow is health. You have to have blood flow for any tissue in the body to be working optimally. Mercier Therapy mobilizes organs, making them move again. Anything that's living must be moving, and if it's not moving, it's slowly losing its life. So we mobilize the organs, which restores function from a movement perspective and restores blood flow. So we went over all of the details of what therapy would look like, and that's 1 hour of treatment each week for 6 weeks. And I saw her the following week and we got started.
Mercier Therapy is not a massage. It is not a spa treatment. It is intense therapy.
Mercier Therapy is an external therapy. It's done via the abdomen and it's non-invasive.
After my first 1 hour session, I felt a little bit nauseated. I felt kind of like sore, if you will, and tired. I was ready for bed.
Help to mobilize the organs and get them back to their original placement prior to C-section, but also to restore the blood flow. And with doing so, optimizing overall pelvic health so that she could start training again and get back to her craft, which I knew was very important to her. So women typically feel taller when they get off my table, and it's really interesting that they explain that to me because usually our tailbone is tucked, and when they get up off the table, they feel taller because everything is released in the front. They feel freer. They can actually tell me that they felt something move.
After my last session, I felt great in the sense that everything felt smooth and soft. My scar didn't feel as gristly, and it just felt like everything was kind of put back into place where it needed to be. I think after going through the Mercier Therapy, it helped my body recover the way that it was supposed to, and it helped me get back to training sooner than I would if I would have not had the therapy. Mercier Therapy is not only important for women with C-section recovery, but it's also vital for women that are struggling with infertility.
So, optimal blood flow to the pelvic organs for fertility is critical. Most times women will give up their fertility and walk into a fertility clinic and say, hey, get me pregnant. But whoa, let's wait a second here. That is like mowing the lawn and mowing all the dandelions down, but leaving the root. We're not getting to the root cause. The root cause for most fertility cases, because 60% of fertility cases are unexplained, is probably poor organ function. If we can improve organ mobility, we can improve optimal blood flow. And by doing so, everything else just works well. And we have an 83% success rate with our pregnancies. I have women flying in from all over the world to see me. And I have so far a 9 out of 10 pregnancy rate with them and an 83% pregnancy rate in my local practice here. It's been amazing.
What I would suggest for women that are questioning Mercier Therapy is, do you love yourself? Do you love your body? Do you care about yourself? Because if you did care about yourself, you would seek out this treatment so that you could get back to feeling like your old self.